So exercise guidelines for exercise referral when we're dealing with someone who's got osteo and rheumatoid arthritis. So I'll go through this. I'll have a handout for you and you should be able to see this in your exercise referral notes. So when it comes to osteoarthritis, if we look at aerobic activity, the main aim is going to be to develop and improve the cardiovascular system. So the frequency of it should be 2 to 5 times per week. The intensity, we want to progress this one, and we have to really be careful because the person will and may have mobility issues. So we want to progress this to 60 to 80% of their maximum heart rate, as ones I've highlighted here, or 11 to 12 rate of perceived exertion on the border scale, 6 to 20. The time of aerobic activity should be between 5 minutes and gradually increasing this up to 20 minutes. Now this is the one just to highlight here. It should be a combination of low to moderate weight bearing activities. So if we're walking, for example, what I've got down here, that's what the person could be doing outside, they could be doing that in the gym, and it's low impact on the joints. The person can be doing cycling, but as long as the cycling's got no impact on the joints. Elliptical walkers, they're really good for this. Some clients are like this, the recumbent bike. You can actually do a bike, a standard bike on the gym, just make sure that we've set it up really well to that person, to actually educate the person a bit more on the setup to suit themselves, to take pressure off joints of their body. Aqua aerobics, fantastic. In the water, takes the pressure away and takes the resistance, the pressure around about the joints. Proprioceptive exercises, so we're looking at the balance side of things, coordination. 1 to 2, the frequency is 1 to 2 to 3 to 5 times per week. Now, when you're doing this, we need to be looking at the feedback from the actual client themselves. We've got to get to know the client and observe the client. So, is the person in pain? And getting to know your client is going to be vital to know what is pain and what's maybe a push of what the person's just pushing the exercise. But this is very, very important. Time of activity, 5 minutes plus, and it is dynamic coordination we should be aiming for in balance activities. So perturbation training, which is going to be balance boards, foam pads and different things to get proprioceptive exercise in. Coordination, for example, they are really good ways to improve this discipline. And the other one here is flexibility exercise is recommended, which is between 1 to 3 repetitions, between 1 to 2 and 3 to 5 times per week. The intensity here, very, very important. It should be within a pain-free range of movement. So when the person's performing any of these activities here, especially flexibility, so if you've got something in a static leg stretch or they're actually stretching it, they should be going anywhere past the pain threshold. And it should be a graded exposure to pain, to stiffness and mobility, taking into account mobility limitations of the person. So we're gradually increasing it. And each movement is 5 to 8 seconds per movement. Now, this here with the flexibility, you probably see this in gyms, you probably see outside, and people are tempted to do it themselves as trainers to ignore the warm-up and the cool-down. Well, especially with these two conditions, we do not, under any circumstance, miss out the warm-up and cool-down. That is very, very important because of the joints of the body as well, or the joints of the body. Warm-ups, we take longer in the warm-up, so your warm-up may take, we'll say, 10 minutes to actually warm up. Dynamic movements, so arm swings, dynamic arm swings we might be doing. As an example, it could be dynamic squats, multi-joint movements. When we come to the cool down, we can be looking at static, developmental and maintenance stretching. The actual goals of each of these, so if we can look at the aerobic goals, that is going to be to improve the cardiovascular system. We're going to look at proprioceptive, that's to increase joint proprioception and joint stability. And finally here, flexibility to decrease pain and stiffness, improve the person's walking and daily tasks. Now, something on strength training, you'll not see anything up because there is insufficient data to provide useful guidelines. So it is insufficient data when it comes to strength training that they have on this. You can exercise somebody to a normal person's guidelines, which is general to the general population of the United Kingdom. But what is agreed is functional training. That is important for the person to be able to perform daily tasks, improve their daily activities, their daily range of movements. So you could be using, for example, a lot more body weight movements. It's easy to use, it's easy because there is no equipment and the person can do this themselves. You could be using resistance bands, for example. Now the good thing about resistance bands is it's less intimidating for some individuals. The person could be using free weights. Now free weights, there's nothing wrong with free weights, it can be very good. The only issue is it is free and it's a bit more unstable, but they are cheap for the person to do it in the house, and they could be doing it in the gym as well. Functional training is the way to go here, but the one big thing to keep away from with this type of training would be powerlifting. Things that cause impact on the joints. So power training would be out, but resistance training is good. Fixed machines, for example, may be good for people because they are easy to use. They can increase intensity nice and gradual, and they're in a fixed position. So they are good for people who've got osteo and rheumatoid arthritis. So that's a brief outline here. It is in your notes as well. Might be a wee bit easier to read in your notes and refer back to. Any issues, give me a shout.